All right, welcome everyone. Thank you for coming tonight. We're going to call the meeting to order. Has everyone had a chance to approve or review the minutes? If so, a motion to approve.
Make a motion to approve.
Second. Second by EJ. Any questions on the motion? All those in favor? Opposed? Okay. Correspondence excused tonight: Maria Walker, Joe Santiago, Patty McEnany. One disciplinary action: Shane Mezzacopa, Staten Island, New York. Had his certification suspended for 1 year effective March 16th, 2015. The suspension is stayed. He's been assessed a civil penalty of $2,000. Of that, $1,500 is suspended contingent upon compliance with the stipulation in order for violations of Part 816C and 816D. Correspondents are listed there. Anybody would like to see them, they're up here. I guess we'll move right to CON.
The CON committee had 2 meetings this month. First in the matter of capital district ambulance, transferring their name of operating, chief operating officer table pending further information. Secondly, we met in the matter of the town of Providence ambulance service, request for converting their municipal operating certificate to a permanent operating certificate. On June 15th, we held a meeting and we had found there were some deficiencies and had not received the fitness and competency report from the state, reviewed by DOH. The application was deemed complete and moved forward to a public hearing. The public hearing was conducted here at WEMO on June 15th. Following testimony, there was no controversy spoken at the meeting. The hearing was concluded, but the record held open pending receipt of the fitness and competency reports. On June 18th, we received from the state no bar to fitness and competency of all the involved parties, and so therefore we'd like to bring it to a vote tonight. To accept the recommendation of the hearing officer, it is the recommendation of the hearing officer that the application made by the town of Providence Ambulance Service to convert its municipal declaration to a permanent operating certificate be approved.
Thank you. Does everybody understand the motion from the CON committee? Okay, this calls for a roll call vote. Les Freeman?
In favor.
Bill Price?
In favor.
Jim Regan?
In favor.
PJ?
In favor.
Dave Bettini?
In favor.
Aiden O'Connor?
In favor.
Kathy Allen?
In favor.
Amy Manchester? I'll be in favor. Mike Sini?
I'll abstain since I'm a coordinator there.
Dale?
In favor.
Jim Vina?
In favor.
Chris?
In favor.
Mike Daly?
In favor.
Al Jagoda?
In favor.
Steve Kroll?
In favor.
Carol?
In favor.
Lynn Kane?
In favor.
Jim Stairs?
In favor.
EJ?
In favor.
Sorry, I always goof up your name. Could you?
I'm sorry, Zor. You can call me Zor. In favor.
Thank you. Steve Retzoff?
In favor.
Jeff Williams?
In favor.
Any members that I missed? (22) in favor with 1 abstention. Motion carries.
2 abstentions.
2 abstentions.
2 abstentions. Who was the second one?
Mike and Amy.
Oh, I'm sorry. Let me correct that then. Thank you for a correction. Good. Motion carries. Evan. Amber?
In reading.
With that,
Anne Marie.
she didn't sign in. In favor, not in favor, abstention? I'm sorry?
That she won't forget next time. Crowded for that.
Calling you people.
Thanks a lot. Thank you very much.
Thank you for coming. Reports to committees. Everything discussed in executive will be brought up tonight. Executive Director's report.
Hopefully everybody has a copy. Most of this is routine and basic, but two highlights there. If you look at the training voucher update, I did contact Tom Bahana directly from DOH. Sent a lot of CCs out on that email, and today we received a check for $27,655 of that outstanding money. It was about 50. They've made good on about 40 of it to date. So slowly but surely we're getting the money that they owe us. The other one is pertains to the EMS awards. All the regional winners have been notified by certified mail, and I've received the receipts back. Special congratulations tonight, and we have some people in the house from Clifton Park Half Moon Emergency Corps who received statewide awards for EMS excellence. I think it's in quality and safety. So congratulations to Clifton Park Half Moon. And that concludes my report unless anybody has any questions.
Any questions for Tim? Treasurer's report.
Still in a very good cash position. You heard Tim just talk about the accounts receivable with the course reimbursement, so he's actively pursuing that. There are no bills for payment tonight, so we're in good shape there. We also did have our audit presented to us tonight by Marvin and Company. I won't go into that in full detail. We'll be here for a couple hours, and I don't think we want that. But we do have the report. Tim also has the report if anybody's interested. Did show that we had a good financial year, and hats off to Tim for making that happen.
Finance Committee.
I just want to echo what PJ said in congratulating Tim and the staff on a great audit. Significant was that our management letter did not contain any significant findings, and the auditors pointed out affirmatively that all of the things they had identified several years ago as challenges to us for our accounting systems were now corrected and operating as they should be. So good work to Tim and working through it with the team. And that's it for tonight.
Thank you, sir. Medical Director, MAC, and Academic.
I'm actually going to split them up. We'll do Medical Director first. The first component of that is that we had the kickoff meeting for the Mission Lifeline grant that we got through the Heart Association. That's actually going to be actively working on ST elevation MI care and door to balloon / recognition to perfusion time at the hospitals in the area. It's going to involve both patients that are originally cared for by DMS as well as walk-ins to facilities, both of whom have the ability to do STEMI care and those who don't. The first meeting was held after the MAC meeting, and every single hospital in the area, including Amsterdam and Gloversville, were here. A lot of good ideas, good concepts, and everybody bought well into it. What's going to happen with each of these different hospital systems is going to be given the opportunity to record their data in the same manner, so it can then be looked at in a blinded fashion by each of those hospitals, and they can share best practices without getting into proprietary concern. This is a great opportunity to continue to advance STEMI care in the region. The other piece that's going to be important for us moving forward that's going to work and piggyback directly off this is, as you remember, probably about 5 or 6 years ago, we went out and got grant funding from the Ferrioli Foundation and CDPHP and the Med, St. Peter's, and Ellis all were involved at getting the modems for everybody. The 2G modems will age out relatively soon. We'll need to upgrade, and this is going to provide a good framework and data for us to build the next grant application to do that. I would encourage anybody who's going out to buy new equipment, though, to buy new equipment with transmission capability so we don't have to go after quite as big a grant, which would be very helpful. These things aren't cheap. The other thing to let everybody know is that Remo is now a participant in the Office of Fire Prevention and Control and Department of Health First Response Naloxone program. We did the first fire department first response naloxone training program. There's still some question as to exactly how to work out the protocols and procedures for those first response fire departments that aren't involved in regular EMS care, to figure out how this is going to work for them so they don't end up in potentially in harm's way by going to calls where they are not dispatched to. But that's an ongoing project that we're going to assist OFPC with as we can. The first class was actually done at West Albany and was very successful. I'll do the academic committee first. Most notable piece of information out of the academic committee, and Howard's here, is Howard, Rich Beebe, and folks from the Aram's region are working together on a project that'll be an educational materials for BLS CPAP. We'll look forward to seeing those in September, Howard?
Hopefully.
Sure. Okay. On to the MAC. Two things. First is a clarification. There were two items of business that I think this body needs to know about. The first is that Delmar Bethlehem sent in a letter requesting an upgrade in service from their prior intermediate to advanced. That, from a procedural perspective, is something that we do at the MAC. When intermediate went away and advanced became the new status in its place, what we had agreed to as a procedure was that a letter of notification would be enough for you to then vote on and say, go forward. That occurred for Delmar Bethlehem at this meeting. That's pertinent because there was another approval process that came to us as well that didn't get fully vetted because in part of the Mission Lifeline meeting that was going to start right afterwards. And this was an application for paramedic level upgrade by the town of Catskill. When the town of Catskill presented, George June gave a very nice presentation about their information. Several MAC members then raised questions. Unfortunately, what this did was it ate up all of the time that we had remaining before all of the people coming in for the Mission Lifeline meeting needed to be in the building instead of standing outside in the sun. The information, because there was going to be lengthy discussion, the application for the town of Catskill was tabled to the September meeting. That led to significant amounts of discussion as to whether or not this was appropriate. I actually have sought the advice of council, and council responded today, which I sent out to the members of the MAC. We will be holding a special meeting at the request of Dr. Stanger, who is the medical director for the town of Catskill, and Greene County EMS. We will be holding a special meeting in July at whichever date we have the most MAC members available to meet at. We have a poll out. And so far, it looks like we have 2 dates when we're going to be able to have a quorum, and we will conduct a meeting and finalize this process rather than letting the town of Catskill wait till September, which sounded as though it was the fairest way to approach this for all of the constituents concerned.
Thank you. EMS Council. I didn't touch, I don't know when the last meeting was.
We just met a couple weeks ago, and quite a bit at the State EMS Council as well as the CMAC. A number of new projects moving forward. There was a new hemorrhage control protocol approved with some refinements that will be moving towards statewide implementation, so we should expect to see that relatively soon. And this incorporates many of the devices that we may already be using that are not part of the protocol, that are have really advanced the equipment that's available to us in hemorrhage protocol. So we'll be seeing that. The syringe-based intramuscular epi demonstration project for anaphylaxis has been approved. Most of that through the hard work of Dr. Daly, who's one of the principal investigators on this demonstration program. There's an estimate of as much as $10 million a year can be saved by not purchasing EpiPens
and discarding them upon their expiration without being used. This is now moved on to the Commissioner of Health for his approval, and once approved, a statewide training module will be built, and this will be a demonstration program, so the training module will be a standardized training module. There'll be reporting requirements, and agencies that participate will have to agree to go straight and narrow so we can show the efficacy of this as the demonstration program goes forward. In addition, Dr. Daly mentioned the CPAP protocol that was approved for the BLS level. Now I know that the regional training program is moving forward. There's also going to be a new spinal immobilization protocol that will eliminate a significant amount of backboarding that is deemed to no longer be necessary. That will be moving forward. Agencies have been cautioned not to, on their own, implement a protocol, despite the fact that many people here have been waiting for a long time, and there'll be a lot of backboards at garage sales sometime in the not-too-distant future. But for now, proceed as we operate, but you should expect a new spinal immobilization protocol coming our way. The community paramedicine bill has passed the New York State Assembly. It was introduced in the New York State Senate. However, the legislature is going to try and just to end their session tomorrow or shortly thereafter, and the bill is not going to pass the Senate. We made incredible progress for a bill its first time through. Sometimes it takes bills several sessions. We do have some challenges we're going to have to work through over the next year. The biggest challenge is that not everyone in the healthcare field supports us. We have strong support from hospitals. We have strong support from emergency physicians. However, the home health field feels very much like us, that they're, as we are trying to work on community paramedicine, because we see that places where we can expand what we do to fill gaps in the healthcare system. The home healthcare field, frankly, feels the same way. They viewed our bill as a little bit of as a threat, so we're going to have the interested associations will be working with the home care field throughout the summer and fall. So when the legislature reconvenes in January, hopefully there's a consensus that can move community paramedicine forward. But certainly Onion, which is and the New York State Volunteer Ambulance Rescue Association, and a number of the other groups have done a really nice job working on this. So. The state had some leftover grant money in the brain injury area, so I'm going to pass this around. This is a brain injury wallet card. Apparently they have printed these, I don't know, Rich, if you know what number is, but we were told that mass quantity of these will be available. A large number. So this is a consumer tool that will be provided to us in whatever numbers we wish, that you can hand out at community events. You can hand out to patients. You can hand out, as a kit. I'll just pass it around. It basically is designed for the consumer to talk about what a traumatic brain injury is, what you should be doing, what are the signs and symptoms. So a nice little bonus. The Part 800 regulations that codify the CME program. The CME refresher program still has not been completely 100% made permanent. The Part 800 regulations are now moving through their final clearance process that will finally make the CME program permanent. The blood regulations, for those of you that are following them, are also in the final clearance process that will allow 8 paramedics with specialized training to transport a patient that's hanging blood. I recognize you've heard that now for 10 successive years or something thereof, but we're really, really close. The advisory has come out on recommended pediatric equipment for ambulances in an EMS Bureau policy statement, and with the hope that all agencies will adopt those as their equipment for pediatrics. And the last thing is significant conversation beginning about designs of the ambulance for the future. There have been a number of national bodies that have looked at what ambulances will look like in the future from the standpoint of safety and equipment on there. There has been a little bit of a gasoline thrown on, and I understand that Chevy is going to stop producing the Duramax engine for the purpose of ambulances. So the number of people that produce big, large boxes that can be converted into ambulances is going to be significantly decreased with the decisions made by basically Ford and Chevrolet. Who knows what else will happen in the marketplace, but there's definitely a discussion at the State EMS Council going on about whether or not we should wade into the discussions of what ambulances look like in the future, or simply let the other national bodies that are duking it out as to their vision go forward. And I think that's it. We meet again sometime this fall. Okay. Any questions?
Thank you, sir. Nurses Committee. MCI Committee,
No report.
membership.
We have 2 new members this evening. Do we need to do anything on them, Chairman?
You can announce it, that's fine.
Okay. From Columbia County, we now have a Ken Martin. Is Ken here?
No, it's not.
Or Michael Breen?
Nope.
But we'll see them sometime.
You will.
All right.
That's why their name is there.
Okay. So that fills the 2 open seats of Columbia County. I've reached out to other members in another county about the outstanding openings in their counties.
Thank you very much. QI Committee.
We have a meeting scheduled in September. We have 2 planned projects for the fall and winter.
Any questions for Dean? That's it for committee reports. Just to clarify the CON vote for the stenographic record, and so the state understands what the vote was, and we don't have to hear from Dana Jonas down the road. It was 22 in favor, 0 against, and 2 abstentions. County reports, we'll go to Albany County.
No report.
Columbia County.
Columbia County, yes, we're actively on board with Mission Lifeline. Obviously, we had one hospital that served 2 counties down there. So we've been working together with the hospital and the 911 center, change some of the protocols for dispatch so we get these patients out of the hospital and the door to balloon time hopefully will be reduced drastically from our rural area.
Excellent, thank you, sir. Greene County.
Greene County is doing well. Good evening, everyone. When it comes to the county-wide task force, we're still in motion. We should have an answer by about September, October to determine whether or not in 2016 anything will actually come to fruition with that. And Greene County EMS Incorporated, the paramedic system, would like to thank Remo for their award, receiving Agency of the Year. So we have worked hard and look to work even harder next year and years to come. Any questions for Greene County? Thank you.
Thank you, Abe. Rensselaer County, I'd like to welcome Amy Manchester, newly appointed EMS coordinator.
Thank you. I have no reports. I didn't know I was supposed to.
Very well. Saratoga County, I have nothing. Mike, is there anything you'd like to add?
Other than the town of Providence has a new permanent operating certificate now.
Schenectady County? Excellent. Okay, moving on to new business. We have course sponsorship renewals for Greene County EMS Council, Mohawk, Colony, and Momentum Performance Materials. They've been reviewed. I don't see any reason to not recommend these without reservation. So, a motion from somebody?
I'll make a motion that we approve all 4.
Second from somebody? Jim, thank you. All those in favor?
Aye.
Opposed? Thank you, everyone. Also under new business, this was being brought up by me. There hasn't been a real comprehensive review of the bylaws of this agency in decades. I can't remember when. I asked Rich because his institutional memory is a little farther back than mine, and he's talking about when George Johnson and Earl Evans did it. So it's well overdue in my opinion. Joe Santiago, who isn't here tonight, and I'm not volunteering him because he's not here, he actually agreed to do this, is going to chair this committee. If anybody would like to help him in this endeavor, let me know and I'll forward your name on to Joe. I think that's it for new business. Any items from the floor? Anything? Of course.
Mr. Chairman, I'd like to make a motion that we dispense with the July and August meeting until such time something earth-shattering needs our attention.
A second for that motion?
I'll be in.
No second.
What is it, Jim? Take your
Come on,
pick.
Jim.
Any questions about that? In favor, or all those in favor? Opposed? Anything anybody else would like to bring up?
Make a motion.
Mac business, you want to cancel both Remsco meetings.
What's that?
If you had scheduled unfinished Mac.
Mac doesn't have anything to do with this.
That's the max it should.
But thank you for asking. Okay, no other business, motion to adjourn? By Lynn, second.